Cardiovascular disease is one of the leading causes of death worldwide. We often hear the sudden death of people or loved ones, and we wonder what could have caused their death. But let me ask you, when was the last time you considered your heart? Not in the emotional sense, but in the physical and life-sustaining sense. Welcome to another episode of the Health Priority Podcast. In today's episode, we will be talking about how to protect your heart and live a long, healthy life. I am honored to be joined by Dr. Fobi, who is a cardio fellow and also works at the Kolebu Teaching Hospital. Dr. Fobi, welcome today.
Thank you very much, Anita. Thanks for having me in the studio.
You're welcome. So how long have you been in training?
I've been a doctor for the past 13 years, but currently I'm training to be a cardiologist and I'm in my third year, so about 3 years now.
Okay, I guess you're somebody who is passionate about cardiovascular health, and I hope you'll be sharing with us valuable insights into cardiovascular health.
Definitely.
Yes.
Yeah.
So let's start with the basics. When we talk about heart health, what do we mean by that, and why is it important?
Okay. So the human body is amazing. It's made up of different organs.
Okay.
And the heart is one of such organs in the body. What the heart does is it pumps blood to all parts of the body and then receives the blood back after it's been given oxygen by the lungs. And that is how the body functions. When conception happens or a fetus is formed, by the third week or so, the heart has already started pumping.
Okay.
At that time, the mother is supplying all the needs to the placenta.
Yes.
But the heart my heart has been working since we were fetuses, and it will work till the day we die.
Yeah, that's interesting.
It's very interesting, isn't it? Yeah.
So I know that when we say cardiovascular, so that means the cardio is the heart, and
Exactly.
and the vascular
is all the blood vessels
so
that join to the heart.
Oh,
so
okay.
in reality, you can't talk about the heart in isolation.
Okay.
You have to talk about the heart with the vessels.
Okay.
Actually, we do say sometimes that the heart is like a very large vessel.
Yeah.
But yeah, the heart is the main organ and it's attached to various vessels. Like we said, since it's pumping blood to all other organs, if that main function is impaired or that this organ is hurt or vulnerable, then it affects all systems.
Yes.
So that's one of the reasons why the heart or cardiovascular diseases is so important.
Okay. So I guess since you are in training, you've been on the ward for so many years.
Yeah,
and
of course.
You've come along to see, you've seen a lot of common diseases that can you share with us some of the very common one in our society today or in the country today?
Sure. Even before I entered cardiology, we were seeing cardiovascular diseases.
Yes.
Yeah, because it's the leading cause of death globally. And it used to be thought to be a Western disease, but now we found that it's actually even more common in the middle income.
Yeah, so when I was doing my trainings at Kolebu, I had a chance to be at your department once, just once. But what I saw was older people were the ones getting these conditions. Well, I think
that was the initial.
Now even the younger ones are dying out of it.
Exactly. So we are passionate, and I'm passionate about advocacy and preventative measures. Because, like you said, some of the common conditions that are associated with cardiovascular system or the heart and the vessels, I think everyone knows about stroke.
Yes.
So stroke is one of the common conditions we see. We have something we call heart failure, when the pump function or the relaxation function of the heart is impaired. Then we have other conditions that are considered cardiovascular, even though they are not directly the heart. But then if you are having the arteries, those are the vessels that supply your at the body.
Yes.
So if you're having arteries in the legs being affected or other parts of the body affected, we call peripheral artery disease. If it's the arteries supplying your kidneys are impaired, you can have kidney disease.
Yeah, okay.
You can, if the arteries supplying your nerves are impaired, you can even have neuropathy, which is nerve disease. So conditions are varied, but all
So is it like they are interconnected in a way?
So it's like you have a pump, like you live in a storage building, you have a pump that is pumping the water. If you open the tap in the bathroom or in the kitchen or wherever, it's coming. But if that pump is spoiled downstairs or wherever you keep your pump, you can't get water whether you're in the kitchen or you're in the bathroom or wherever. So there's that connection because the blood is supplying blood to all systems. And we are created such that we need the nutrients and oxygen the blood supplies to all these systems for them to function.
Yeah.
So if there's a problem with the pump, then all those systems can get.
So that means if there's an impairment in the nerve, let's say around the kidney, that means it could also lead to an impairment of the heart to cause, so that blood cannot really flow.
So is it forwards and backwards or just?
Yeah.
So usually it's more forwards, but then, like you said, if there's a kidney problem, it can lead to the arteries around the nerves being stressed. And if they are stressed, it's like the heart is pumping all right, but this place, there's so much pressure and stress or tension there that eventually the heart gets tired.
Yeah.
So that back function is also there. So that's an important point you just made.
That's nice. So what are some of the risk factors that could lead to like these heart conditions that we are seeing today?
Yeah. The commonest risk factor is hypertension, also known as high blood pressure, which you need a whole episode to delve in, and I'm sure we will do that later. So that's the commonest risk factor. But then we like to break the risk factors into modifiable and non-modifiable. Yes. So there are some non-modifiable, you can't do anything about it, risk factors like being black. The literature and research has shown that in blacks, hypertension is more prevalent than in whites. Being male is a risk factor. Doesn't mean that all blacks or all males will get hypertension, but relatively it's a risk factor. Growing, as we grow older, body changes.
Genetics
is also a risk factor on its own. It falls under being black and all that. We think there's some genetic components to that, apart from environmental. Yeah. So growing older on its own is a risk factor, and then having a family history. So if in your family the hypertension is very prevalent, it means your risk of getting or my risk of getting hypertension is higher. For the modifiable risk factors, which we put a lot of emphasis on, because then we can do something about that. The hypertension is a modifiable risk factor because we can control hypertension.
We can prevent
it. We can give medications if it comes. Diabetes is a risk factor, which we can also manage. High fat foods or dyslipidemia, high cholesterol levels, all those are risk factors. Lifestyle. So if you're someone who doesn't walk a lot and you sit a lot, you're quite inactive, it's a risk factor. High sodium or high salt diet. Smoking is also one of the major risk factors that we see. And now with all these inflammatory conditions going around, sometimes some autoimmune conditions and all that, we are getting more risk factors for cardiovascular diseases. Yes, so those are the common risk factors.
So where are you going to categorize broken heart?
So there's actually there's a term for broken heart in medicine. We call it takuchumbo. But it's not. So the reason why we call it broken heart is there are a few people who, when they hear very bad news like someone broke up with them or death of a loved one,
we feel like killing ourselves.
there's a part of the heart that can actually bulge or form an aneurysm. And that was discovered by, I don't know if it's Japanese or not, someone called with the name Takuchumbo. So yeah, but yeah, technically there's
It's
nothing
not-
like broken heart. Yeah.
Oh, okay. So
There's
it's
nothing
not
like
it's
broken
not
heart.
going to, because people like their heart is pumping.
Yeah, so that's the so emotional response. The body is triggered into the fight mode. Some hormones are released. Then you can have, but there's nothing technically like broken heart. The heart is so strong, it can't get broken.
Okay, is it the last thing to die in the like?
It's a whole diagnosis
Like
before
when
you declare
somebody
someone
die,
is dead.
is the heart like the last thing to die?
So we call it cardiopulmonary system. But
Okay.
then it's not only that, the brain also.
Yeah. Okay.
Yeah, so there are technical terminologies to it. But for us, the cardiologists, or in the cardiologist field, we like to say the heart, if the heart is gone, you are dead. But then the neurologists, those who deal with the brain, will tell you that, why is this? We can say brain dead and all that. Yeah. But typically, for us to pronounce someone dead, it means your heart is not beating on its own, your nerves are not working, and the whole system has shut down.
Okay.
Yes.
So you talked about like when somebody is being inactive, not exercising. That means that's like a prevention, like a lifestyle changes thing.
Yeah.
So can you take us through the prevention and what can we do to prevent all these heart conditions?
Great. All right. That's what I'm happy about. Yes. Because now the world is leaning more towards preventative medicine compared to curative.
Oh, okay.
Yeah, but that doesn't mean we don't do curative. But yeah, so lifestyle, something that most people have control over. Yeah, so we always encourage that you keep a healthy weight and then even be active. You don't have to be exercising to lose weight, but even if you think you are fit, you don't need to lose weight or not. The activity, exercise releases hormones, stimulates the fat cells to absorb glucose better and all that. So overall, being active is healthy.
Yeah.
Yes. Also, if you are overweight, then it's good to lose some weight. Okay? And when it comes to diets, a balanced meal is great. More of your vegetables compared to the high sodium or high salt foods and high fat foods and highly processed foods, because the highly processed foods also contain a lot of sodium and other additives. So we can also check our diets.
So the salts that we take, I know salt is like sodium.
Yes. Salt is made up of sodium.
Yes. So
the dietitians will tell you the quantity you should take. I think I remember either 4 or 8 grams, not more than that per day. But then, I don't remember the exact values. So we're not saying don't eat salt. We're saying too much of it. Yes. Too much of it is bad. And you'll be surprised that I think the 4 or 8 grams is equivalent to like a teaspoon. And you'll be surprised that at the end of the day, the chicken you've chewed, the small rice you've eaten, the soup you've taken, the quantity of salt in all of that combined per day is more than that. So inadvertently, we end up eating a lot of salt that we don't need.
Yeah, and
some people even want more salt. After that, they're even adding more salt.
And then go to the chop bars.
I'm telling you, because you go to work, you might not cook yourself and all that. So it's dicey, but if you're conscious, make an effort. Try to eat a low salt diet.
What about our starchy foods? Because now we eat banku rice, all those breakdowns
starch on its own is good, unless you have a condition like diabetes. That starch eventually is broken down to sugar in the body. So if you are diabetic, your problem is your body can't really regulate your sugar, whether it's due to lack of insulin or the body not being sensitive to the insulin. So for diabetics, they have a different diet altogether, because then they have to reduce their starch, because at a point in time, the starch person A can eat who is not diabetic, and person B will eat who is diabetic. The sugar that is released at the end of the digestion, the person A body can regulate it, but person B's body can't. So if you're diabetic, that's when we are fussy about the amount of starch. But generally, a healthy, balanced diet, which includes starch, protein, and vitamins, the greens and all that, is healthy. Yeah.
Okay. So to go back to the exercise, those of us that I don't normally go to the gym, but when I get to the gym, the cardio, like, is it really good for us?
Yeah. So we advocate it doesn't have to be going to the gym or cardio alone. We advocate that you do an activity It could be high intensity or it could be low intensity. I mean, we used to advocate for 5 times a week, at least 30 minutes per day or 10 minutes per day. But now realize that if you're able to do 30 minutes per day 3 times a week, it's considered being active enough.
Or even walking.
So even walking,
Yeah.
I personally, I prefer walking. I'm not a gym person.
Okay.
So on days, and you can't, I mean, work and family and everything can be every day. So if you're able to walk 30 minutes a day 3 times a week, you can choose to skip, you can choose to use the treadmill, you can use to go to the gym. Anything that increases your heart rate and burns a bit of
fat,
or at least increases your metabolism and all that, it's fine. It's considered being active.
Okay.
And if you're lucky and you're in a field that you are going up and down the stairs, or you are a footballer or something, those things, they don't have a problem.
Okay.
Yeah.
So apart from the diet, the exercise, is there any other preventable way?
Yeah, importantly, when it comes to smoking, okay.
Now, you're taking the shisha, the balloons.
Thank you. So when you ask people, typically like consultation, what do you smoke? Oh, no, I don't smoke. Hey. Then you realize, oh, what about shisha? Like, oh, okay, shisha. I'm like, shisha is actually nicotine. It's nicotine. Nicotine is what is in cigarettes. So now it's become a trend.
No, but they'll tell you that, oh, these Jamaicans, they smoke, but they are okay.
Okay. How do you know they are okay?
I'll smoke, but I'll eat healthy to balance it, you know.
So yeah, it's not, we are not saying because you smoke automatically you get a condition.
You don't get the
No, we're not saying because you smoke automatically you get a condition.
Okay.
But we are saying that because you smoke, your risk of getting a condition can be as high as 8 times, 5 times compared to someone who doesn't smoke. But of course, it's multifactorial. It depends on your genetics, like you said, your family history, your lifestyle in general. Okay, so some people appear very healthy, but like your introduction was, may suddenly collapse or have a heart attack or something. And someone may appear unhealthy in our layman terms, but will not have those conditions. So it's not like a black and white picture. But then over the years, various research has shown that these things increase your risk of getting it, and those who are able to stop decrease their risk factor a bit compared to those who don't. So yeah, smoking is something we always advocate that we try and stop.
Is it like the main preventable thing? Like
no, it's part of the preventable things we are talking about, the weight loss, diets, and all that.
Yeah, I think among the youth, the smoking is very much common.
Yeah,
especially Dirty December,
I'm telling you. So now we have to, I think the shisha should also come. We know how the cigarette, they are compelled to put smoking is bad for you. Shisha, they should put a label on.
Oh, but there's a label on the cigarette.
Yeah, I'm saying just like it is on cigarette, they should put on shisha.
But they still take it. They see it and still take it. So
some people actually don't believe it's nicotine. They think it's just, some people think it's something else. I don't want to come and say things. Okay. Yeah, that they are smoking. They don't believe that it's the same as smoking a cigarette. So those people are actually judgmental of people who smoke cigarette. Like, oh, me, I don't smoke cigarettes, I smoke shisha. But then it contains the same thing. So maybe that awareness and that message should be sent out too, so that, I mean, it's like being a parent. You can train your child and hope they stick to it. Our part is to advocate and put the information out. So is there a time that you've come across a patient with a heart condition which has been like deteriorated? Can you share like your experience with us? Or deteriorated as in because of risk factors, like or the progression of a disease? Yeah, like when a person acquired the condition, the symptoms, how the person went through, like the severity of it. Okay, all right. So one of the common conditions we see now is what we call heart failure, where the pump function, the ability of the heart to pump, is reduced. So usually they may come in with a bit of breathlessness and swelling. So I want to give a caveat here, because people like to pick things from what you say and then run with it. If you are listening to me and maybe you may have symptoms like this, doesn't mean you have heart failure. You should go to the hospital and get fully assessed, because various conditions have similar presentations. Okay, so I just wanted to put that caveat out. Yes, but commonly the heart failure, they may come with breathlessness or difficulty breathing, and then a limb swelling, like the feet may be swollen, very tight, they get tired easily, and Some of them may know they may have been diagnosed with hypertension years back, but said, so, sometimes when I check it's fine. So when it's high, then I take my medicine. When it's low, I don't take it. Or I start taking it, and one or two reasons I've stopped. Some will say they never knew. If they had not been this ill and come to hospital, they've never been told they have hypertension.
And some of them also like to take like the herbal medicines.
That is one problem we face here. I don't know what it is. I mean, there's an orthodox medications
in the hospitals now.
Yeah, ultimately, some of them are synthesized in labs, but ultimately most of them are from plants and all that. But they've gone through a rigorous process to know this dose does this dose will be overdosed and all that. But the herbal concoctions out there, some of them are not dosed and all that, and people will take that instead of their orthodox medications and come in so bad. And then when they come in, and we go through the process of diagnosing, then we treat. So the diagnosis will involve talking to the patient, examining the patient, doing lab tests, and some investigations including an echo, ECG, chest X-ray, and all that. And then when the diagnosis is made, there are medications that, according to guidelines, help improve, the heart function. But ultimately, you may not get back to how your heart was. Yeah. Some people are able to respond well and at least stay at that level we found them with improved symptoms. Some are able to improve their symptoms and also their heart function itself. And some are not able to, especially if they come in so late. And ultimately, most of these cardiovascular diseases are progressive. Heart failure in particular. I mean, if you had a stroke before and you're lucky and we do all the preventative stuff now, your risk of getting another stroke is higher. But I know people who have had stroke and never had stroke again because now they are taking very good care of themselves and complying to their treatment, which includes the medication, diet, and all that. But heart failure in particular is a chronic progressive condition. So we have people who come in so late, or they come in and they come in and out of hospital because along the line, it's a whole complex thing. So yeah, it's disheartening. Especially like you said, we are seeing a lot of these things in the younger people now.
Yeah. So I was advised that when I wake up early from bed, I should sit at the edge of my bed to rest.
So that's what we call the morning surge. You know, when we sleep, the whole body, everything, your heart rate, breathing, everything slows down. When we wake up, like we kickstart the body, so there's a surge.
Okay.
But I think that is physiological. There's a surge for your body to start get into action, and whether you sit down for a bit or you go straight into action, it shouldn't really affect it. Unless you are someone who getting outside, maybe you have some postural hypotension or dizziness and all those things, then it would be good to do what you just said.
Okay, so
but physiologically, your body's everything's supposed to go up for you to start the day.
Okay, so that means heart failure is different from myocardial infarction.
Oh yeah.
Oh, okay. Yeah, that's like two different things.
It's two different. Myocardial infarction commonly is known as heart attack.
Oh, okay.
And with that one, it's like the blood supply to the heart itself. So the heart is giving out blood, but it has smaller vessels that supplies the muscle of the heart. Because every muscle needs blood, needs oxygen and a whole other thing. So the vessels supplying the heart muscle itself, when there's blockade from either a cholesterol plaque or thrombosis, whatever, if the supply to that muscle is impaired, then you have what we call a myocardial infarction.
So these sudden death, that's like
it's one of the causes.
Could it be
of it.
One of the causes?
It's one of the causes. One of the causes, because myocardial infarction can give you abnormal heartbeats, like an arrhythmia, and that's what we will say. So an arrhythmia for some people may be fatal, maybe not. Myocardial infarction may be fatal for some people, maybe not. A stroke may be fatal for some people, maybe not. There's a whole lot of conditions. We have what we call aneurysms and dissection, where the blood vessels, whether through genetics or family history or some other condition, has bulged out a bit. So some small injury or pressure, then these muscles may rupture and the person may suddenly collapse, bleed out and all that. We can't finish heart disease or heart
just the
in the day.
Yeah,
so this is just the basics, not to alarm anyone, but
Oh,
to
no.
create awareness.
Yes, just to create awareness. I mean, prevention is better
Than
so
cure.
I mean, prevention is better than the treatment, right?
Better than cure. But then most of these conditions are chronic. So one issue that I would like to
But are
bring
some
out.
treatable, like
No, all of them are
more
treatable.
yes, but
We have treatment for
you-
all.
you
but
advocate for the prevention
exactly,
rather.
and the treatments, most of them, the treatment doesn't lead to cure. So if you're on treatment, it's lifelong, and that scares people. But I don't think that should be scary, because as we wake up every day, we go to work every day, something you are doing till you retire. You eat every day. Will you say that I've eaten all my life, I'm tired of eating? No. So if you're on medication for life, take it like it's part of your food.
Okay.
And with one thing that we've also realized is people are very worried about side effects of the medication than side effects of the condition itself. So you have people saying, I've been medication for so long, I've stopped. And then the condition, because it's a chronic condition, it's not medications, it surges up, and they have complications from their condition,
So with the
but not the medication.
So with the medication you are saying, I heard that when these men that takes hypertension drugs have
So it's not like
sex.
it's not like
They have some malfunctions. Yeah.
how do I even phrase this? So it's not 100% true, or it's not like by force or one cup fits all. Okay, the conditions themselves, the hypertension, you know what causes. So I'm going to be blunt. See, most of them come complain about erectile dysfunction.
Yeah.
They can't sustain erection, or it doesn't last long. But the conditions themselves, the hypertension, we are saying it affects the blood vessels, causing thickening and hardening. And what causes erection is blood flowing to the penis. So if the vessels there are already sick, the condition itself can cause diabetes, can atherosclerosis, can. Some of the medication side effects can do that as well, because their function is to sort of stress the heart less and make sure the blood vessels is not overly flowing and all that. Some of the medications can do that, but the medications, there are various classes, and if you think you're having problems based on the medication, you talk to your nearest health provider. We switch for you, and most people come back fine, or people actually stop on their own and they come back and they realize that even when they stop the medication, they still had a problem. Yeah, so, but when they get better treatment and then we switch the medications, they are good to go. And some people may need medications to help them with the erection. We can prescribe those ones for them if indicated.
Oh, okay.
So like if you're a male and...
But is that advisable?
No, if indicated, if there's indication for it for this patient, we will prescribe for you. We are not against. People think they'll rather go over the counter and go and buy and not discuss with their doctors. If you come and discuss with me, we look at all your medications, we look at your condition and all that, and we think that none of your condition or your medications are not the cause of it, and there are no contraindications, I can prescribe Viagra for the patient.
Okay.
Yes. What happens is some people go and do concussions, buy various things, and they abuse it. And the Viagra is temporary. You're not supposed to take it every time and all that. It's maybe for a period we think that, oh, the body needs to recover or something, we should get your function back. And another thing we see is that what the men should understand, this is for you, the men. What you should understand is as you are growing, how you were in your youth will not be the same. But some people say, they are living past glories. So they want to go back to how they are youthful. So yeah, it's a delicate situation. And but we are very open to discussing these things with our patients, and so don't be hesitant to talk to your doctor about these things. That's why we are here. If we think you need to see a specialist in that field, a urologist or whatever, we will send you to see the person. So people shouldn't be quick to blame their medication. Okay. So other causes, it's multifactorial, even mental. Yeah. Mental stress, problems, and other can affect libido and a lot of things, even compared to physical stuff. So it's a whole like multifactorial thing that needs in-depth. Yeah. Mm-hmm.
So I guess with all these cardiovascular diseases, regular checkups and screenings are very much important.